This is an upgrade with PowerPoint. First, I tell patients, let's find disease. Get a coronary calcium score to see if there's any plaque in the heart. If this is 0, then get a CIMT of the carotids to see if there is plaque in the carotid artery. If this is 0, we can then go on to get an ABI, which is blood pressure in the legs compared to the arms. This usually is positive in smokers or diabetics with bad circulation in the legs. Finally, to see if there's inflammation, get C-reactive protein high sensitivity, or better yet, LP plaque blood test. Once you know that the patient has disease, I would suggest that we try to do everything we can to prevent progression of plaque or even get regression of plaque. To do this, we need to get the LDL particle number with an NMR blood test less than 750. The HDL ideally should be greater than 50. Triglycerides, actually normal triglycerides is less than 100. The inflammation level should be normal. Often if I see this elevated, I will give more fish oil, as fish oil and statins decrease inflammation by 70%. Get the blood pressure less than or equal to 125 systolic. Waist should be less than 40 inches for men, 38 inches for women. For other Asians, it can actually be less than 35 inches. To get to these goals, combination therapy is the safest way to go. I think doctors often get frustrated because they go to maximum dose of statin and still don't get to goals. If you do combination therapy, you will get to goal. Moderate dose of statin is better because high dose will make the patient more vulnerable to rhabdomyolysis. Niacin in the form of Enduracin, 500 milligrams, 1 tablet twice a day. Fish oil, check the back of the bottle, DHA plus EPA, greater than 850 milligrams. Vitamin D, 1 to 2,000 units a day. In my practice among the elderly, I often find that 2,000 units is needed on a daily basis. Often if your vitamin D level is low, you have to go to 50,000 units once a week for 8 weeks, and then go to maintenance daily dose. Aspirin 81 milligrams a day for men over 45 and women over 55. And then, as I say, combination therapy with Zetia, Welchol, or Tricor will get your patient to goal. In my clinic, we do CIMTs of the carotids to motivate the patient, to show them that we can get progression or prevent progression or regression of plaque by getting to the goals. Other physicians might say these 4 tests mentioned on the first slide are not indicated. The truth is, the NCEP guidelines from 2001 do state emerging risk factors are useful. And when you look at these 3 guidelines, you can see that for anybody with one risk factor, which is a man over 45 or a woman over 55, you can get these tests and it is indicated.